Assalamu alaikum wa rahmatullahi wa barakatuh. I hope you and your families are fine and doing well. And thank you everyone for joining us today on the event about cancer bone, which is organized by Health Services Department in collaboration with the Staff Social Club and the OrthoMed Orthopedic and Rehabilitation Center. Our speaker for today, Dr. Wahib Saadi, consultant orthopedic and foot and ankle deformity surgery at King Fahd Military Hospital and also Med Orthopedic and Rehabilitation Center, who will give us lecture covering all aspects related to cancer, bone and foot deformities, mainly flat foot, starting from early detection to the latest methods of treatment. You are welcome, Dr. Wahib, and thank you for your presence with us today. And at the end of the lecture, there will be an interactive question and answer between our staff and Dr. Wahib. Now, let me give the floor to Dr. Wahib to give his lecture. Dr. Wahib, the floor is yours.
Assalamu alaikum
تفضل يا فندم.
warahmatullahi. Good afternoon, all. Thank you, Dr. Hanafi, and for the all audience for joining us for today explanation. We'll talk about explanation problems around foot and ankle, starting by oncology, malignancy, then some sort of deformities, and why our foot hurts. And we'll start, inshallah, and every single topic we will have few minutes for discussion. If you allow me to hear some question from you. Bismillah ar-Rahman ar-Rahim. So our main topics today, we are going to talk about the tumor, as I mentioned, some common causes about foot and ankle pain, and what habits that we can avoid, and to escape the pain and live without any some sort of pain. As we know that our foot combined contains three elements of foot. As a specialty of foot, we don't say foot actually, we say hind foot and midfoot components. So mainly we are, because we are International Day of the Foot Cancer and Oncology, we'll talk about what cancer and tumors around, what are the common cancer and tumors around foot and ankle, and what is the cancer. As all of you know, that's abnormal cells with abnormal uncontrolled growth happening to the body, attacking to the normal system and normal cells. So we have some the most common cancer about the foot. It's a osteosarcoma. Osteo means bone, started from the bone. Chondro means cartilage, which is the outer surface of the bone. It's called chondrosarcoma. Actually, unfortunately, the tumors around foot and ankle presented late after fungating mass seen by the patient or somebody else observing the foot. The other thing, soft tissue swelling, which causes sarcoma as well, comes from the fluid in the joint around the foot and ankle, which called synovial sarcoma. Again, melanoma and squamous cell carcinoma, most common for us here in I'm exposed about squamous cell carcinoma too much around the foot and ankle, which is the main cause, untreated, ignored wound around foot and ankle more than 12 months, which can be converted from unhealthy wound to cancer wound. Any abnormalities, swelling, wound with non-healing, we need to quick review about the age, about risk factor, family history, previous radiation of the same patient, or there is specific risk factor like arthritis, or I mentioned the chronic wounds. So the main three things we need to check it always. It's at night sweating, loss of weight, and uh, loss of appetite. These three main pillars, if they combine together, that raise the suspicious of tumors either in the foot or all in the body. Associated depends on the place of the tumor. So these three things are very important to review with for us or for companies with us. Associated fatigability and lump in the limb as well. So when do we need to take action? If we have abnormal lump around foot and ankle, abnormal skin changes, do not wait, please visit your physician. So that's, and once you visit your physician, quick review about medical, genetic, and history as well. And the treatment of the tumors around foot and ankle varies from radiation therapy, chemotherapy, and excision. Fortunately, the most common tumors about foot and ankle is gonna be the benign tumors. So let's talk about unsung heroes for everybody of us. So unsung heroes is our feet. It carries us the whole body weight. It contains a lot of bones, a lot of joints, muscle, and tendons, and the most stabilizer of the body. And if any simple alternate in the mechanics of the foot will cause starting hip, going proximally upward, hip pain, knee pain, then hip pain, then lower back pain. Always check your feet. What are the most common causes about feet pain? As from we'll start from the left side to the right. The most common is plantar fasciitis, the start up morning pain. Then this is the site of the pain, most common in the heel. And when you start to walk, you cannot put your whole feet in the floor. Then the bunion or hallux valgus, as you know, as it knows. Then ankle arthritis, pes planovalgus or flat foot, and the lateral ankle pain from the twisting injury. This is the most common causes of the foot pain and ankle as well. This is the major causes of the foot and ankle pain with non-athlete or non-traumatic patient is the stylish and supportive shoes. Ignore the pain, skip the stretching or strengthening before the exercises. Ignore till the problem becomes more bigger, and or majority of the problems of the foot and ankle is non-operative treatment unless it became chronic that we need surgical intervention. We'll start quick review about some problems. Here we hallux valgus, it's a bunion, which is the bunion. Hallux means the big toe, valgus going outward of the big toe, and varus as well. It's the most worst complication. The big toe goes here medially toward the other foot, which is major complication. So do not wait till come the other side. And this is the majority of the pain. It's at the first big toe at the level of the joint, sometimes associated bump, which is here, and affects the shoes wearing and daily activities. Unfortunately, the high percentage with the bunion affect the female, which is always due to the stylish shoes wearing. And the treatment is not just for cosmetic, it's just to improve quality of life and walking as well. Quick review when you visit genetics, footwear. Actually, the footwear affects the foot too much. Mechanics as well, which we have problem, we'll explain later. Medical condition like diabetes, rheumatoid arthritis, injury with the sport and athlete people. We'll go to Though the history, this is the worst. Sorry for saying that, but this is one of the worst shows ever in life, which is squeezing the whole toes, and we don't feel pain, but with time it will destroy the anatomy of the forefoot components. This is also the mechanic alteration around the ankle. This is the normal. Here, starting to deviation to the lateral aspect. This is the lesser toe. Also here, the lesser toe. So the hind foot or the calcaneus or the posterior aspect of the ankle going outward. Also this one compensating by the big toe to be in hallux valgus. More complication coming. See, the second toe started to be deformed as well. Here as well, bis plano valgus or neuromuscular due to neuromuscular condition due to the cerebral palsy or subsequent congenital diagnosis. Here, this is athlete post-traumatic of the plantar plate, the major stabilizer of the big toe. So first, when you visit your physician, will ask about the symptoms affecting life activities, redness, swelling, inflammation around the joint, which mainly medial at the inner side, painful range of motion, sometimes the abnormal hump cause colossus because of the friction and abnormal bump during the shoes. Persistent and discomfort that worsen with activities, bursitis, then deformity causes more deformities in the lesser toes. Lesser toes are from the second to fifth. Then the metatarsalgia, also this is pain comes at night due to abnormal alignment of the forefoot. So always think about comfortable shoes, not stylish shoes, please. Here is sort of the deformity, which is here we can say severe. Here the bump due to the chronic deformity and bursitis, and the redness as you see, and the overlapping of the toes. The key message about the bunion or hallux valgus, early diagnosis to prevent will prevent the progression, but will not correct, especially after maturation. So we can stop the progression with some sort of non-operative treatment. Once you visit your doctor, the degree of the deviation or deformity will establish and measured at that visit. Then the condition will be started with non-operative treatment, and rather than with starting from tapping, which is by the tape of physical therapy, this will realign the toe like 50 to 80%, then gives you some sort of pain relief at the medial aspect, padding as well over the bunion or the swelling over the bump or the swelling of the medial aspect, orthotics, which is comes to keep the hallux in normal alignment, medication as pain management, pain analgesia as per request, physical therapy exercises. As you see here with the band, it tried to overstretch the soft tissue, which pulled the hallux to the valgus to make it long and stretch to prevent the deviation as well. Ice therapy, ice is the key of pain reliever, non-invasive pain reliever around foot and ankle. Surgical intervention varies from taking the lumbar bump away, corrective osteotomy, which we cut the bone and realign and normalize the alignment of the hallux. Recovery is 6 to 12 weeks with some sort of old surgery. Recently, we do the surgeries and patient can walk second day with full weight bearing and non-splinting. Here is the majority. Here the study shows that if we correct our shoes, the effectiveness is very high, especially with young ages. So it depends with non-operative treatment will affect much more if we are younger. So please take care of your feet and wear nice foot shoes to protect it. As we said, can be managed non-surgically. If we go to the further deterioration of the deformity, will cause overlapping of the toes, overpressure, and some joint arthritis as well. Here is the splint we applied, and there is some market splints as well. You can wear it and wear the normal shoes without any bothering. Always and always check your foot and compare both of your feet together to see if any abnormality of alignment. Hallux valgus can be one side and could be also both sides. Again, also the major, as unsung heroes of our body, we need to take care about the weight that they carry. So reduction of the weight will affect in the non-operative protocol. Here is some exercises. Try to do toes down, play with the ball, with the blunter aspect of the foot. So now I think if we are listening to the lecture, so we can do exercises for our feet while we are listening. Try to maintain the fanning of the toes. Understanding will escape the standing exercises. Range of motion, circumduction of the range of motion, toes goes down, inflection and extension as well. So as we are talking about topics, we will finish the question at the end of the at the end of this lecture, if you don't mind. So we mentioned that its deformity causes discomfort and pain, genetics, footwear, and foot mechanics. Early intervention and surgical will help too much. The second subject, the third subject, sorry, it's going to be the Achilles. It's posterior ankle pain or posterior heel pain. There are two major causes. They are only two causes that they cause the pain at the posterior ankle, which bothers a lot. And please, if you feel any pain, do not ignore it at that area, because ignoring of this pain causes more damage to the Achilles tendon. Achilles tendon is the strongest tendon, carries the body from posterior, starting from the posterior knee down to the penis area. So I will show you the Achilles tendon later on. And here is the Haglund deformity. Both conditions, Achilles tendon and Haglund deformity, comes together or separately. But if the Haglunds comes 100%, the Achilles tendon will be affected. Figure out this piece of bone, it's extra bone. When you do dorsiflexion of the ankle, it will relieve the pain, but it will decrease the pain. When you do dorsiflexion, the bone goes toward the Achilles tendon, which lies here. And every single movement will cause injury to the Achilles tendon. It acts like an inside knife, including sharp edge. So what type of the Achilles tendon? It's a tendon, started from simple to severe, associated capsule around the Achilles tendon. It's tendinitis, tendinosis, and paratendinitis, which is inflammation. Ignoring of this condition could be chronic inflammation, degeneration, and sometimes lead to the pop sound, which is unfortunately the injury of the Achilles or the cut. So Haglund is, you see hump, sometimes you feel hump without seeing, which is early stage of the bone formation of the Haglund. So common in runners, Achilles tendon, which is caused by overuse of the tendon. Haglund deformity, common due to footwear. So shoes are difficult. When we go to for the stylist, so we are going to affect the improper foot shoes, which is the compartment, your midfoot, which cause overtight of the Achilles and posterior leg compartment. Sudden movement that comes to the Achilles tendon, which is my micro injury with time, micro to the Achilles and introduce inflammation if it changes over the calcaneus repeated. And as I mentioned previously, can be together Achilles with Haglund and bursitis. But if the Haglund is there, 100% Achilles will be affected. With no way will be intact without Haglund. That's why when you feel a bump or pain, please review your foot and ankle. Risk factor age, it's above 30 years nowadays. We are seeing it around 2025, and majority cases of the massive devices. Unfortunately, this is the gender affecting the woman because of the footwear. Men always here in our country or also out worldwide, they like to open back shoes, activity level, and lifestyle, board training or warm up before the exercises. Here is the example. Here is one example of the hard sole hind foot support, which is wrong shoes we cannot use. We need some absorption to be taken by the shoes, not to increase the impact of the calcaneus and the ankle as well. Here, here is the excellent example for the heel and cushion-oid. We call it cushion-oid. Always look for cushion-oid shoes if you don't have any foot problem. Here is, as I mentioned, I want to show you the Achilles. Here is the posterior leg, and all the muscle end with calcaneus Achilles tendon, which attaches to the calcaneus, starting by inflammation, and tendinitis. If we don't treat these two conditions, chronic pain will be affecting and will affect our life activities and mobilization, especially when we start our day, leaving our beds, and also the bone, which we call it, or it's named by Haglund deformity. If we don't treat it, think about that there is body knife inside and hurting your Achilles tendon every single flexion of the ankle. Every once in a while, to the Achilles tendon. Early recognition and symptom to prevent serious complication like insertion rupture or chronic pain. Diagnosis, always history. What is your complaint? And what is the nature of the pain? Causes of the pain? Is it constant with range of motion? Time of the pain? Wake up pain, or we call it startup pain, continuous daily pain. We'll also check for the bump around the posterior ankle or Achilles and feel your area there. If there is pain or no, always compare both sides. And this is the normal alignment of the ankle. We resume now from the, we stopped at the Achilles tendon and Haglund deformity as well. So as I mentioned, the Haglund deformity is a piece of bone extra involvement in the calcaneus, acting like body knife, which hurts the calcaneus always. So we need, as we discussed, that we need to visit the doctor, and if there is continuous pain, uh, unfortunately, I will tell you a small story, like a few seconds, that I had a patient. She is 36 years old, was with pain, went to a physician who gave her 27 times cortisone injection in the Achilles tendon, presented to me with, I can say there is no Achilles insertion, which is 4 centimeter end of the Achilles. Uh, so she ignored the pain at the beginning. She went to the wrong person, and she ended with a huge procedure that costed her prolonged rehabilitation and physical therapy. So do not ignore any pain. And the diagnosis, I think we mentioned this, and we went through this. Physical examination, swelling, alignment of the ankle, uh, a range of motion of the ankle, and also what x-rays we need. We do x-rays to see the calcaneus and the bone bump, which is Haglund deformity. Ultrasound MRI, which is always we do the MRI to evaluate the anatomy and the healthy of the Achilles tendon. Medical history as well, we go through to review the medical history, some genetics involving in the Haglund deformity of the calcaneus. And again, most of cases can manage an operative treatment. Footwear, sorry for saying, saying footwear. This is the key of good, healthy feet for everybody. Uh, if we establish the diagnosis, we advise to wear open back soft shoes. Also, we can raise the heel to deload the Achilles tendon. We raise it with a piece of insole, put it under the heel only. So keeping like inside shoes, high heel, going always from 0.6 to 1 inch, which is affects too much to relieve the pain. Physical therapy, we can use stretching and strengthening exercises of the posterior compartment of the leg. Also shockwave there, ultrasound guided pain reliever as well, lengthening of the compartment, relief of the overload of the Achilles tendon. Again, we give medications for short time to relieve the pain. Surgical treatment varies from non-invasive up till invasive surgeries. We can starting with take out the bone and evaluate the distal, the end part of the Achilles. If it's healthy, we do not touch it. If it's not healthy, we do reconstruction using new anchors, using new modalities, which called anchors, to reinforce the Achilles tendon, as our feet is the unsung heroes of our body. Haglund removal, and as we said, all cases can be managed non-operatively in early stages. And the physical therapy play big roles in the management of this condition. If we ensure good lengthening of the Achilles tendon, and anti-inflammatory or pain reliever modalities using ultrasound or shockwave as well. So we need you to use nice footwear, nice shoes. Always do stretch and strengthening exercises. I keep always saying to our people, you have fixed time to pray 5 times a day. Keep 3 of them as a mandatory to stretch and strengthening your Achilles tendon. If you are athlete, try to minimize the activity and go back gradually to increase the level of the activities. Again, orthotics, it can help us in the offload Achilles tendon. 1 inch maximum below the heel will deload the Achilles tendon, reduce our weight, control the weight, as each foot carries 50% of body weight, and figure out this small organ offloading by all body. Now, sorry, we are, I think, taking too much time for explanation, but this all conditions are important. The last topic, it's the most common topic bothering from pediatric, adolescent, adult, then etc., which is adult flat foot. And what is it? It is loss of the arch of the midfoot, as I mentioned, the middle aspect of the foot, and deteriorating within time. There is various causes. We are going to talk about the adult flat foot to understand the cause of the pain, recognize the symptoms, explore the treatment options. So the major stabilizer of the midfoot arch, which is the midfoot arch is the arch takes and absorbs the shock by the body weight while we stand, while we walk. So if this arch decreased and became all attached to the floor, too much pain. The main stabilizer is tibialis posterior tendon, which is the major tendon. If it affects, will deteriorate the foot at the middle aspect. That's why they name it another. They call it. It has another name called tibialis posterior insufficiency, which is the other name of flat foot in adults. The midfoot is shock absorber, distributing when during the walking, and the arch, it's major weakness of it, major stabilizer of it is tibialis posterior tendon. It's not that much, but when it start to have the inflammation, degeneration, and weakness of tibialis posterior tendon, will lead to adult acquired flat foot. So we have the causes as the major stabilizer is the tendon, which is tibialis posterior tendon, weakness, inflammation, rupture can cause the flat foot. Which is also arthritis, chronic arthritis affecting foot and ankle, rheumatoid, like rheumatoid arthritis. Rheumatoid arthritis is one of the diseases causes deformity in the hands, number one, then foot, number two. So can deteriorate soft tissue and bone as well within time. Weight, we need to control our weight to de-stress our foot. Diabetes, which is another condition which is majority of our population faces, like 60 to 70% having Charcot arthropathy, which leads to flat foot, which is breakdown of the midfoot bones. Aging as well, which is related to weight, over stress, overload, flattening of the midfoot, arthritis, then flat foot, all continuous pressure of the foot from heel to toes touching the floor. Athletes, high impact activities, runners without proper shoes, gender, ladies are at high risk due to footwear habits, age as from 40 and above in adult, and can cause younger than that. Alternation of the alignment of ankle, hind foot, and midfoot as well. Medical condition, diabetes, inflammatory disease, footwear as well. And the flat foot can be genetic, lifestyle, and underlying condition as arthritis, like rheumatoid arthritis. So what brings patient to the clinic, or what concern of the patient, that he has medial midfoot pain, majority below the ankle going to the big toe, but not reaching to the big toe. Then the arch of the foot is not reaching the normal, not reaching the floor, like the toes attach the floor, the heel attach the floor, and there is a gap in the midfoot. So the flat foot, this gap disappear and collapse, attaching the floor, which is due to the tibialis posterior insufficiency or weakness, then causes continuous pain at the middle aspect of the foot. Patient now will go to the doctor. Doctor, see, I have chronic pain here. My foot is deforming, really, and all the foot is teaching the floor. We need to check and evaluate the tibialis posterior right away. It's clinically diagnosed at the beginning. We can check it in the clinic without any further radiological investigation, some sort of examination. If we failed for non-operative management, at that time we need to do further radiological, like x-rays, to measure the angles, to put the surgical planning for corrective osteotomies or soft tissue readjustment, and rigid or limit flat foot deformity. Rigid and limit flat foot deformity, it's a majority now. If we ignore that condition, at the beginning comes flexible flat foot. So the heel is moves medial and lateral. If we leave it and ignore it, unfortunately, the heel will stick in one position, which is deviated to the lateral, and that we call it a rigid flat foot. And this is scenario we don't want to face, actually, because the whole plan will be changed. Early recognition symptoms and to prevent the progression to improve the quality of life. This is the majority why we care about foot quality of life, walking, exercises. Everybody of us likes to have some sort of walking, exercising, whatever the age. We have certain exercises we need to do. So first thing, we check the arch alignment from posterior to the middle. We ask the patient to stand on his or her toes, and we see from posterior how is the ankle aligned. Is it corrected, which is now flexible, not corrected? Unfortunately, we say that this is fixed deformity, so it's too advanced to start the treatment, but there is also always treatment. We'll ask about the level of activities, any family history about the flat foot, any genetic as well. So we'll ask for X-rays, MRI, X-rays to assess the bone alignment, MRI to assess the tibialis posterior tendon. Always we need to assess the tibialis posterior tendon, because some early cases we didn't do any further bony procedure. We do only soft tissue around the tibialis posterior, either debridement, either reinforcement, or bring the neighbor tendon and reattach it with the tibialis posterior. When you see your doctor, if the pain is persistent and you lost your arch of the midfoot, difficulty in show wear, walking, standing, and the persistence of the symptoms despite any using of better shoes. Fortunately, nowadays, there is some certain companies started to compete each other for foot care shoes especially in the flat foot, because its common condition was negligible in the previous, I think, 20 years ago. They were not treating the flat foot non-operatively till it comes to the end stages and treated operatively. Nowadays, there is shows in the market. We can advise, we can check what kind of shows, and we ask the patient to try it and bring it to the clinic, and we see the alignment with the shows as well, if corrected or not. So either conservative or non-operative or non-operative treatment. Majority of cases can be treated non-surgically. We'll ask them to change the foot, with the shoes as well. Use midfoot at the middle aspect. There is arch to support the midfoot. Elevate the midfoot to prevent attaching the floor completely. Open box as well. So again, physical therapy, as the flat foot in the adult started by tibialis posterior dysfunction or inflammation or degeneration. So we work hardly extensive on the physical therapy to strengthen this tendon to avoid any further damage, or we can sometimes regain and healing of the tendon because it's soft tissue, has the same properties like any soft tissue in the body. If we have injury, can be remodeled and treated. Strengthening to improve the calf and Achilles flexibility. Also medication, we can give medication for short time. Again, if the inflammation and the pain is severe at the area of the tibialis posterior, we give injection to relieve the pain. We ask the patient to rest and decrease the activity level of his sport. Ice therapy, we can give the patient. There is some padding. They use it like a socks, which gives you 15 to 20 minutes time ice therapy to the feet, which is relieving the pain, mainly in the midfoot, which is abnormal attachment to the floor. Surgical treatment, it's an advanced or severe pain. It varies from, as I mentioned in the beginning, work on the tibialis posterior tendon, which is the main stabilizer of the foot. Then, if it doesn't work, we work in the correction of bony alignment, osteotomy starting from the heel, which is calcaneus osteotomy, and the midfoot. And we have various of osteotomies to correct it. Then, unfortunately, we don't like to reach to arthrodesis, which is the fusing, which is in the advanced cases or associated arthritis. Recovery 6 to 12 months. Now, the patient can do the surgery and come back to weight bearing after 4 weeks, associating 2 more months, additional months for physical therapy. Within 4 months, he can resume his or she can resume her daily activities. After 6 months, she can run or he can run as well and resume activities. As all surgeries has risk factor, infection, delaying healing of the bone, soft tissue, etc. So not always surgical. We need to exhaust non-surgical treatment. Supportive shoes where there is insole. Unfortunately, I don't know what the picture went, but there is insole. We can put it even not if we couldn't find the nice foot adapted footwear, shoes to our foot. We can create insole to by gait analysis testing for the patient. We have it in our center. Patient comes to us, stays in the. We analyze the gait for him. We see the foot, the weight distribution or around the foot when touching the floor. We have measured 3 points below the big toe, below the lesser two, number two, and the third one is below the middle of the heel. So at that analysis, the system tells us that how is the foot goes when the weight bearing starts, and give us the right measure of the pad insole that we need to put it, and we prepare it as custom made. Then we put it in the patient can put it in the shoes, and wherever he changes or she changes the shoe, her shoes, she take the insole from 1 to 1. Also, we ask for exercises, regular, stretch the muscle of the posterior leg, tibialis posterior as well. Maintain healthy weight, reduce the weight as well. Again, we need to check the foot once in a while. It's always advise our population to check your foot 1 to 2 months, even if you don't, for the elderly, if you don't know how to check the plantar aspect or the heel aspect, use mirror or ask somebody to check it for you. Check from the behind and the alignment. If there is pain around the tibialis posterior, try to avoid overuse that leads to overstretch of the tibialis posterior for certain time, sometimes 6 weeks, to prevent stop the activities. So in conclusion, adult flat foot is common condition that arch collapse, middle arch, the posterior tibial dysfunction. That's why the other name came. Overuse, injury, arthritis, obesity, other diseases like diabetes, rheumatoid arthritis. Early intervention with non-surgical treatment manage most cases effectively. Prevention involves more smart footwear and foot care habit. When do you need to see your doctor? The pain is continuous. The deterioration of the midfoot is going further down, touching the floor. You go to see your doctor. Even before seeing your doctor, you need to do foot analysis, and I can't say as sorry for mentioning that we check for the females periodically for the breast lumps. Advising our patients or population do gait analysis once in a while, like 1 to 2 years. Come, just do not seek medical advice. Come check your gait analysis, weight distribution, just to know what's going on, and keep reference for you and compare if any other further deterioration, and that will tell you any abnormality started with your foot. So supportive shoes, how to make our feet happy. Supportive shoes, do not ignore any pain last more than 2 weeks. Strengthen our calves and posterior leg regularly. Do not rely on Google. See your doctor. There is nowadays multiple varieties of channels to do consultation. There is everywhere clinics, and there is also teleconsultation. You can talk to your doctor as well, and go to the specialty that you are looking for. Sorry for at the beginning. Sorry for the interruption happened during the lecture. I'm here ending we are reached to our last slide. Happy that they enjoyed the explanation for the foot problems around foot and ankle problems that we face regularly with varieties of ages and activity levels as well gender. I'm here and happy to hear from you. Any question?
Thank you very much, Dr. Wahib. We will open the floor for the question, and I think we will get 1 or 2 questions only, because the time is attacking us. We have almost 10 minutes to end at the end. Okay.
Hopefully,
Okay.
I'm open and hopefully I can meet them. I think we have next week we can meet them as well.
Inshallah, we want to announce that Dr. Wahib, we are thankful for him. We will have him in a subspecialty clinic next week, inshallah. We will arrange it with OrthoMed clinic, inshallah. And we are happy he will be within us here in the coming week, inshallah. Okay, our brother Hassan, you can ask your question.
Okay, thank you, Dr. Wahib, for the informative session. I have foot pain in my right foot for the last 1 year, and I have done consultations with a few doctors, also did MRI. The latest MRI says I have degenerative changes at the first metatarsal joint. So I want to understand what are the options I have, because I'm really suffering for last 1 year. Thank you.
Yeah, metatarsal, I think you, metatarsal, I mean with the finger, with the toe or with the midfoot? It's distal or?
Low, it's in the hallux.
Yeah.
In the,
yeah, I think now you are in the matter of bunion and differential diagnosis bunion or hallux rigidus. If you start, if you are here, I can see you. If you start an operative treatment, I think you have, how old are you?
36.
36, yeah. Any deviation? Like
no.
Like bunion?
No, it's not bunion. The doctor said it might be the hallux rigidus. This is what he's suspecting.
I don't think so. It's hallux rigidus with this age, but I think it's a plantar plate issue that the major stabilizer of the hallux. It doesn't reach to bunion, alhamdulillah, but I think with the MRI images we can figure out what's going on. But
okay, I have the MRI and I'm in Jeddah. I would like to see you whenever you're here in IDB.
Happy to see you, brother. Happy to see you. My pleasure to see you, inshallah, next week.
Sure. So available. You will advise after seeing the MRI?
Yeah, please.
Okay. Okay. Thank you.
Thank you. The CD with you.
Okay.
From my side, Dr. Wahib, I want to ask the parents have to take care of, to look carefully to their children to notice the gait problem starting from what? From the 2 years or?
From 2 years. Yeah, this is from 2 years. We should observe our kids' weight style, gait style. Yeah, carefully. If the toe is going inside or outside. Inside is benign. Let's say benign, doctor. But if what we are afraid if the toe is going outside. This is congenital flat foot. So if the kids congenital flat foot, up till 90% treated non-operatively, only shows modification, and the result is excellent. So we start to, as you mentioned, thank you for this good question, 2 years and above, till 9 years.
And the treatment have to be started early, to prevent the chronicity.
Yeah, as soon as possible. Once the kids started weight bearing and gait, we need to start the treatment.
Also, the obesity is affecting also, if the one having tolerable food deformity, if he is obese, I think so it is aggravating and increasing the pain and the condition.
Sure. 60
WhatsApp number টা ওর কাছে নাই
কি কয় WhatsApp নাম্বারটা না পাইলে বলো যে আপনারা যে পাসপোর্ট আর যে কেমনে পাইছেন
Brother Imran, I think so you're with your
yeah, thank you, Brother Imran. خلاص continue, doctor. Sorry.
Okay, sorry.
No worries.
But this is one, Dr. Wahib, also I want to ask for the Achilles tendon. There is a cyst sometimes, and what is the main symptom which can give us a highlight that there is a pain in the Achilles? it is affecting by the age يعني by age is يعني can make some pain which is not mainly Achilles pathology ولا this is
Yes. Yes, the age can cause, Doctor, about rather than from Achilles pathology, it's a paracalcaneus bursitis, pericalcaneus bursitis, which is the structure between the ankle joint and the Achilles. It's bursa and gives us pain. And sometimes if you do MRI, Achilles is normal. You do X-rays, Haglund is not there, and there is pain. And you will see it in the MRI. There is bursitis around the Achilles. So yeah, it causes pain, and the pain is if we scale it, it's 7 out of 10. And our aging, yeah, affecting the Achilles. If we don't wear good shoes from the beginning. But
يعني the main treatment is to wear a good shoes, but the local injection يعني I want to ask you يعني because I noticed that the local injections now with the steroids with the steroids and like that, it is more nowadays. It is preferred ولا you have to start first with the good shoes?
والله دكتور, if any steroid given in any Achilles comes to me, it hurts my heart like hell. Better to leave him, do not give him a steroid. A steroid is a mask. It's acting like a mask. You cover something, you don't treat something.
With the drawbacks of fibrosis after that, of course.
Yeah, you cannot stop the Achilles for a moment, because we need to go, to toilet, to wash our to do our pray. We have certain activities at daily base. You cannot, when you give the injection, it causes chondrolysis and eating the outer layer of the tendon and causes more damage to the tendon, not that treated. Just cover the pain while the ongoing process is becoming more faster.
And the false sensation of being well.
Yeah, false sensation. If we calculate that this tendon will stay like 5 years with this pathology without any management, if you give the injection, it will not last than 1 year. Yes, this is disaster experience giving by nowadays.
Okay. Any one of our colleagues wants to ask Dr. Wahib anything before we close the session?
Yes, Dr. Wahib. Dr. Wahib, this is Dr. Ayman. On many slides you mentioned about choosing good footwear. Now, is there any test or any method to how to choose a good footwear?
Excellent, Dr. Ayman. Dr. Ayman, yeah. أنا دائما بقول as I mentioned, the unsung hero is our feet. So the only method to choose good footwear, doing analysis, going to there is certain places, or there is a lot of places like we have it in our center, Dr. Ayman. You go test your fit, see the distribution of your weight around the foot, and the system will tell you what is the defect and what do you need to wear, what exactly the part you need to elevate, and what exactly the part you need to make it lower in your fit. It's not by clinical examination. If you want it 100%, you need to go to do analysis.
Mm-hmm. Yeah, also, that's what is called the insole, right?
Yeah, the analysis give you the distribution and built-in custom-made insole. Yes.
So much better to do this test or analysis before going to choose any modified footwear.
Please, yeah. And now they are available everywhere, and previously it was very costly, but mashallah now they are very adaptable prices for everybody. I'd advise just go as you do. Sorry for that. breast screening, please do foot screening for both genders. It's important. Really, it's important. We want to walk till the age of 80 and doing exercises for everybody, inshallah.
Inshallah, inshallah. We come now to the end. Finally, we would like to thank Dr. Wahib for his presence with us today. Also, we want to thank the Staff Social Club for helping Health Services Department to organize and arrange for this webinar, and for our staff and their families. Stay safe and hope to see you in other activities. ان شاء الله دكتور وهيب نشوفك الاسبوع القادم بقى فيزيكالي في السب سبيشاليتي كلينيك، واحنا شاكرين مقدما على حضورك معنا ووقتك الغالي اللي قضيته معنا. شكرا جزيلا.
شكرا لكم. I enjoyed a lot. Thank you very much for having me. My pleasure to be with you today and enjoy your weekend. Be safe and see you and be in touch anytime. I'm available.
يعطيكم
شكرا.
العافية.
السلام عليكم ورحمة الله. شكرا يا أستاذ بشاير. شكرا.
الله
مع
يعطيك
السلامة.
العافية دكتور حنفي.
السلام عليكم.
عليكم السلام.